everyone. We're so glad you're here as we start our very first Rare Leader Meetup for 2021. The team here at Global Genes is so excited to have you all, and we hope that you love this presentation as much as we did putting it together. So just a quick agenda for this afternoon. We're starting with welcomes and introductions of our speakers, and then we'll round it up with Q&A, both with the questions that were submitted during registration, and then we'll open it up if our audience today has any additional questions or topics you would like for us to discuss with the panel, and then we'll leave the Zoom session open for a little longer after that for our leaders and organizational leaders from the Foundation Alliance to network with each other. And so without further ado, I'm gonna introduce all three of our speakers today, and then I'll let them take it from there. Ms. Barnett, whose book, The Caregiver's Secret, describes her 20+ years as a caregiver to her aging mother while working full-time, raising a daughter and managing her own chronic illness. She's founder and CEO of the Institute for Family Caregiving in Durham, North Carolina. Walitha is active in several organizations that advocate for family caregivers, paid family and medical leave, aging issues, and dementia research. She's the creator of the Empowered Caregiver Lecture Series, as well as speaker and facilitator for health and wellness programs. She's a participant in the National Institute on Aging Impact Collaboratory and Alzheimer's Association's Lived Experience panel. She's also an annual presenter to first-year medical students at the University of North Carolina Medical School, and has given testimony to congressional panels on the need for paid family and medical leave policies. She is also a certified hospice volunteer and a certified dementia practitioner, and advocates for cancer and Crohn's disease patients. We then have Dr. Friedman. He has a unique voice as a counseling psychologist and the father of an adult son with a rare disease. He specializes in working with families affected by complex medical conditions and provides consultation to rare disease advocacy organizations, pharmaceutical companies, and healthcare organizations and providers. Dr. Friedman speaks nationally and internationally on the emotional experience of individuals and families affected by rare diseases. As a psychologist in private practice, Dr. Friedman provides counseling services to children, adolescents, adults, and families in the Philadelphia area. Dr. Friedman's 25-year-old son, Jack, lives with spinal muscular atrophy. Last but not least, we have Laura Bloom. Laura Bloom is the president and CEO of the Ehlers-Danlos Society and responsible for globally raising awareness of rare, chronic, and invisible diseases, specializing in the Ehlers-Danlos syndromes, hypermobility spectrum disorders, and related conditions. Laura manages coordinated medical collaboration, raising funds for research and focusing on the global progression of EDS and HSD. She speaks at conferences all over the world, lecturing to medical students and professionals, and supports specialists in the field by offering her experience as a leading patient expert. Commemorating 10 years in the field of patient advocacy, Lara was officially also appointed as a professor to practice in patient engagement and global collaboration at Penn State College of Medicine. She is also the Global Strategic Advisor for Global Genes. Ms. Barnett, I'll let you take it from here.
Thank you so much. Good afternoon, everyone. I want to thank Pravarthi for inviting me to offer a few comments from the perspective of the family caregiver. I was moved and humbled and educated, actually, as she shared her personal story and the work of this rare community, including the alliance of over 600 organizations. It was actually a reminder to me to be more inclusive, not only when I talk about the caregiving role, but when I think about the role and all the ways that we support those who are disabled in some way, regardless of the reason. Next slide, please. So on the left here, this is my mother, Ruth Jackson King, about 5 to 6 months before she passed away. She was nearly 91 years old. She lived a full life in spite of 4 hip surgeries, congestive heart failure, essential high blood pressure, undiagnosed and untreated sleep apnea, probably caused by AFib, vascular dementia, and an awful lot of anxiety. I founded an organization, the Institute for Family Caregiving, and I wrote a book, The Caregiver's Secrets, to help me heal and unpack actually my caregiving journey. So now my story. I was her caregiver, as you heard, for over 20 years. It actually affected every area of my life, my health, my career, my finances, my daughter, my social interactions, and even my sleep habits. As a family, we had not prepared, so I've moved my mother into my home. I was working a full-time demanding job, raising my daughter and managing a chronic illness. I like to say, because it really is true, I have been a large consumer of healthcare services. I was diagnosed with Crohn's disease just over 40 years ago. I've had multiple surgeries and have run through an impressive list of biologic drugs, 20 years of prednisone, at least 6 GI doctors, and 5 healthcare systems. And yet, I was unprepared financially, mentally, and emotionally for the demands of the role of family caregiving. Well, let's not call it a role. It's actually a job, and there is a way to do it. Family caregivers are critical to the healthcare delivery system for many reasons. One reason is, and we don't often think about it this way, we are hidden decision makers. So, while medical providers are experts on diagnosis and treatment, the family caregiver is the expert on the patient. I don't think we give ourselves enough credit for this, but with an awareness of all the personal and social factors that influence wellness and care outcomes, the caregiver really is an expert. But it is worth noting that caregivers are usually not aware of their functional importance. That's not so hard to understand. The job is unpaid, and in our society, unpaid work is undervalued. Next slide, please. So, the Institute for Family Caregiving has a 10-point program that is unique in that it is the only program that we know of that is based on peer-to-peer caregiver sharing and support. It's a program where caregivers who have hands-on experience help other caregivers understand the best way to tackle their caregiving problems. As you can see on the right, one of the 7 principles is be a healing team player. So, who is on this healing team? Well, it's the patient, medical providers, the family caregiver, and all those in the community in a supporting role. And this is where you come in. Those of you out there in the community providing support to the caregivers. The welfare and the fate of persons needing care is largely in the caregiver's hands. So, as organizational leaders, it's important to recognize the importance of providing the necessary tools. So, are you offering culturally appropriate support? Do you have information that would be very important about resources. So what we have found is it's important just not to hand over a list, but to go one step further. Help the caregiver to understand how to access these resources. Talk about how to be engaged in the process. Talk about mental health challenges and self-care. None of these things should be off the table. It will sound like I'm repeating myself, but it's because I think it's very important. Caregivers need specific information that they can translate into solving their everyday challenges. They need resources to help them understand the best way to tackle their caregiving problems and get the best health outcomes while avoiding negative impacts to their own health and, importantly, to their own finances. So they want good resources, reliable resources, trustworthy resources. How to do specific tasks, reminders about making the home safe, how to find resources for the person in their care, how to protect their bodies from injury caused by moving and lifting. Even if these resources are readily accessible online, caregivers may need training in how to use online health information, such as the electronic medical record. I think sometimes we make some assumptions that because most of us, or some of us, can quickly find some answers to problems or challenges, that most people can do that. But actually, research shows that that is not actually the truth. I can't remember the age, but I think over about 30% of people over a certain age, I think it's 60, actually don't regularly go online to find answers to their questions because they don't know how to use the technology. So here's what I'm saying. I had a relatively well-paying position, but I was divorced. I had a chronic illness. I had a mother who needed my financial support. As I've said, that's why I moved her into my home. And apparently, I had holes in my 401k and my savings accounts. It's worth noting that 21% of caregivers report being in fair or poor health. Think about that for a minute. If there are over 50 million caregivers in this country taking care of children, or the elderly, or people with rare diseases, if 21% of caregivers report that they are in fair or poor health, I mean, that's a lot of people. That's about 11 million people. We have a saying at the Institute for Family Caregiving: don't lose two. Because it has been reported that caregivers actually have a 63% higher mortality rate than non-caregivers. And a Stanford study reported that 40% of Alzheimer's caregivers die from stress-related disorders before the patient dies. I think that is an indication that makes self-care much more real and much more important. And what we know is that numbers like these are the reason self-care has been elevated to top of mind awareness. Next slide, please. So if you just take a moment to look at this, It is a big deal. So yes, costs associated with caregiving can be a stressor. On just this past Tuesday, I was part of a community panel sharing my personal story and experiences at a press conference introducing bills by the North Carolina House and Senate members advocating for paid medical and family leave and paid sick leave. FMLA is not enough. Leaving the workforce is not an option for many. And we know that caregiving challenges are really being amplified during this COVID-19 pandemic. Next slide, please. So, as organizational leaders, um, we know, I mean, for instance, let's look here at the cost of care. I know, for instance, that I was not keeping up with the expenses associated with helping to care for my mother. All right. So, yes, it would be very easy for a typical caregiver to spend $7,000 a year out of their own pocket. It's really, really important to try to keep up with what we are spending. And like I said, that's how I came to um, have made so many withdrawals from my 401k and my savings account. Of course, we know that there are families who have uh, resources. They have resources for facilities and things like that. But for many people, this kind of expenditure is out of range. Let's move to the next slide, please. As organizational leaders, you must help to lead the charge. Encourage caregivers to speak authoritatively about their lived experiences. Try to understand the amplified challenges around caregiving during this pandemic. Stand ready with resources that will make a real difference in the lives of caregivers, real tools, not platitudes. It's my experience that relatively little support and guidance offered represents the point of view of the caregiver, and even less incorporates the sensibilities of family members who embrace this important role. Having a plan, empathetic guidance, and resources make the job less fearsome for those seeking to be good stewards of the health and safety of those in our care. I want to thank you so much for listening. Now you'll hear from Al Friedman. Dr. Friedman?
Very much, Ms. Barnett. It was a wonderful presentation. And as a family caregiver myself, I'm grateful for your perspective, and I'd like to think I'm a member of my own son's healing team. My name is Al Friedman. I'm coming to you live from picturesque Westchester, Pennsylvania, outside of Philadelphia, Pennsylvania. I am first the father of two children. First, my son Jack, who is pictured here in the photograph together with me. And I have a daughter named Kara, who is 21 years old as well. I am also a psychologist, and I practice specializes in families affected by rare disease, disability, and medical challenges. So I live and I work at the intersection of rare disease and emotional health. And so today I'm going to talk about how leaders like you can support the emotional and mental health needs of your rare disease communities. And I want to acknowledge all of you and thank you for the energy you put into leading your organizations. I didn't have that type of energy and contribute in the ways that I can, and I'm indebted to the people who founded and lead our organization of Cure SMA. Spinal muscular atrophy is my son's condition. My son Jack has taught me a great deal in his life, and he's led me to many extraordinary people and organizations who support families like ours who face similar challenges. And I'm going today to share examples of work that I'm involved with and work that I'm aware of in the area of mental health and emotional health as you all support your rare disease communities. Next slide, please. As I mentioned, I'm first a dad, and my son Jack was diagnosed as an infant at 6 months old with spinal muscular atrophy. And at the time, there was no treatment for this condition back in 1995. And at the time, we were told that our son would live maybe till the age of 2. And the photograph on the left is not an attractive photograph of me, but it's a symbol of what that experience felt like to be faced with a diagnosis of a rare disease that's incurable and at the time untreatable. I was exhausted emotionally and physically, and I quickly experienced so many psychosocial stressors that came with this experience of living with uncertainty, fear of illnesses, physical obstacles and limitations based on my son's physical disabilities, isolation, feeling launched into the twilight zone, into this experience as a parent that no parent should be faced with. So I know a lot about this at a personal level, what it feels like to be in a situation that feels difficult to impossible. And I feel so grateful that my son is still here with us. And in fact, tomorrow we'll be celebrating his 26th birthday. So I feel very, very lucky to have Jack and all the gifts that he gives and all the important lessons he taught me. Once I emotionally reoriented myself in a parenting role, about 20 years ago, I began to offer my professional support, my professional skills to others who face similar situations, and began to do that both locally and with our what was called Families of SMA advocacy organization for spinal muscular atrophy families. And today, in this context, I'll also talk about how the pandemic has understandably shined a light on mental health issues. And I believe that we in the rare disease community have had a head start on the rest of the world because we have been faced with uncertainty and isolation and needing to be so careful with our family members and exposure to illnesses. So I believe we've been in a stronger position than many to face the current conditions. So I'm gonna turn now to examples of rare disease support for mental and emotional health, and some of the examples of the programs that I'm familiar with and have been involved with. First, as a parent, and second, as a professional supporting other families and other organizations. Next slide, please. Our Cure SMA organization was very small and less developed many years ago when I attended our first conference as a scared dad. And over the years, our Cure SMA programs have evolved and developed one piece at a time to include many different support sessions. We all in the rare disease community need connection. We need connection with each other. We understand each other in ways that others don't. And these programs that we have now have evolved over 20 years, one step at a time, one piece at a time. On the left is a list of support sessions that are offered through our organization, through our annual conference. We have sessions we call Talk It Out for families to have the opportunity to be with each other. We have groups for young children, older children, adolescents, and young adults. We have groups for siblings. We have a mom's group. We have a dad's group. We have grandparents groups, all within the purview of our organization and our conference. And the pandemic, as we know, has forced an adaptation of all of our programming. And in my business as a psychologist, we like to say that crisis brings opportunity. And the pandemic has brought about an opportunity to adapt our sessions to online virtual programs. And I had the privilege of facilitating many of these talk it out sessions over the year. Probably my most special professional opportunity is to work with our children in these groups. We also have sessions, workshop sessions on emotional health and mental health with panels of providers, talking about various experiences, diagnoses, how to manage stress, how to move forward after a diagnosis, and how to cope with loss of dreams, and in some cases, sadly, in our community, loss of family members. We also offer a QRSMA specialized program, half-day meeting for newly diagnosed families and specialized program for grieving families. Again, these programs didn't exist many, many years ago when my son was diagnosed, and I feel very privileged to have been a part of helping to develop these programs and experiment with them over a period of time. Next slide, please. Another example of mental health and emotional support programs being offered in the rare disease community is with a group called Pure MLD that I'm familiar with. And these programs have been, this is a smaller organization, and these programs have been virtual only and have a global reach. MLD is a much rarer disease than SMA, so connections are very valuable for these families, and families know each other and are very, very close. And I've been privileged enough to have consultations with newly diagnosed families who are reaching out for support and trying to get their bearings. And I've been fortunate and privileged to host and moderate and facilitate social hours for adults who have MLD and have challenges with socializing, and a caregiver support group. And these groups are meeting regularly, meeting online, and have been very effective and low-cost tools for bringing people together and offering support. Again, all of us who are affected by rare disease need connections with each other, and there aren't many of us around. So to use the technology that's available has been a gift. Next slide, please. A unique opportunity to provide support has come through the new world of newborn screening. Many conditions now are being screened for at birth, and a Screen Plus is an example of an NIH-funded, very large research study that's centered in New York, where babies with 15 different rare diseases, or 14 rare diseases, parents opt in for the screening process. And because of new ability to screen for rare diseases at birth, families who are identified with babies affected by one of these 14 rare diseases have the opportunity to opt in to receive counseling support. So this is another new facet of our rare disease. The fact that we can know about a condition at birth is very new, and the psychological impact of that is significant in different ways than for families who are affected at a later point. I've been privileged to be asked to support these families through this Screen Plus program by providing counseling support when it is needed and asked for from the families whose babies are identified at birth. Spinal muscular atrophy and MLD are two of the 14 diseases that are included in this program. Next slide, please. Another organization that's doing really excellent work is the Friedreichs Ataxia Research Alliance. This is an example of a peer support program that includes a large group of ambassadors who are mentors and affected by this condition themselves, and provide peer counseling support to their community. Their ambassadors, understandably, need support themselves in responding to various situations that come up and challenges faced by members of their community. This is an example of an organization having their peer group, their peer support program, receive mental health training, and also consultation, case consultation when they have challenges with certain families they're trying to support and need consultation. Then it's possible for mental health specialists like myself to be available to provide that kind of consultation and training. Next slide, please. Finally, some other examples of rare disease mental health support involve industry partnerships, as treatments for some of our conditions are being developed, industry partners are collaborative, and they're supporting rare disease community indirectly and directly with various sponsorships of programs that include mental health support. And we're so lucky in our spinal muscular atrophy community to have 3 treatments now, and the industry partnerships have been significant in supporting our family. Second, many advocacy organizations like yours, as you're building programs, need consultation assistance and seek consultation assistance on mental health and emotional health to figure out how to develop programs, and also, again, to advise on situations that arise in mental health that leaders are responding to. So there are, excuse me again, people like me available to provide that kind of consultation, along with training and workshops and Zoom sessions like this one. Virtual programs have been very frequently utilized and customized to meet the needs of specialized population. And again, the pandemic has has brought about a excuse me again, a focus on mental health, and the technology has allowed for greater access for community members around the world to participate in training and workshops. I've been involved with supporting rare disease communities as far away as Australia and Russia and others in Europe this year because of the use of technology being so common now. And I'm going to finish up with a gift to you, my next slide, and I believe the last slide, as an example of our rare disease mental health support. This is probably the greatest gift I receive as a professional each year, is the opportunity in our own care SMA community to facilitate support sessions for our children, who are beautiful, intelligent children, very thoughtful, who don't often have the opportunity to be with each other. And so for the past 15 years, I've had the privilege of helping to facilitate our support groups for our children and adolescents, as our kids also need the opportunity to connect with each other. And for many of our kids, it's the first opportunity for them to meet others like them. Because of the pandemic, we sadly have not been in person this past year and won't be this year, but we have adapted this program to Zoom, and the children are much more adept than I am at managing Zoom because they're all doing it for school now. We all need connection. Our kids need connection, and it's my privilege to be part of this work with our community and other communities, and my privilege to be part of this discussion today. So I'll finish with this gift of our children to you. And by the way, on my left in the photograph in the back, or on the left in the photograph, is my daughter Kara, who's 21 years old, came to our family from Korea as an infant. She is an open-hearted young woman because she is, and because of being Jack's sister, and she volunteers at our conference and helps me do these programs. I thank you for your time and attention. I hope this has been helpful, and I appreciate being included today. And I'd like to finish now and introduce to you Professor Laura, who's going to take it from here. And thank you for listening. Take it away, Laura.
Thank you so much, Al. Appreciate it. So, as we've heard today, there have always been challenges there for the rare disease community. But this year has presented more challenges, I think, than we've ever seen. And there have been some real impacts, not just to the patient community, but also to the organizations that are caring for those patients. So next slide, please. So I'm going to talk a little bit today, thinking and looking through an organizational lens, and how everyone is thinking about what we've all experienced over the past year, and more importantly, how we are going to move ahead. And are we going to go back to the, I think, tried and tested and much loved in-person event, or are we going to stick to purely virtual, or are we going to actually move to what is being talked about more and more, which is this concept of a hybrid event? Next slide, please. And as we make these decisions, about whether to meet in person, whether to bring people together, and what a hybrid event looks like, there's a lot of things we need to think about and consider. For example, bringing together a group of people. Now, for varying sized organizations, that could be bringing 10, 20, 30 people together, 1 to 2, 300 people, or 2 to 3, 4,000 people. And each one of those is going to require a different risk assessment. But fundamentally, the same questions have to be asked. Are we going to think about social distancing when we bring people together? Are we going to have to think about that and reduce numbers? Are we going to have to seat people differently with the spaces in between? Are we going to insist that people wear masks where there's not a medical reason not to? Are we going to insist on vaccines and evidence of those vaccines? Are we going to ask for evidence of a negative COVID test or a recent positive test that then makes them immune? And what are these lessons that we've learned from having so many virtual events that we want to bring in to these new hybrid models? We want to be able to reach as many people as possible. We know that doing virtual meetings allowed us to reach so many more first-time attendees, people that have never been able to come to an in-person event, people that had so many barriers to an in-person event. We don't want to leave those people behind, especially when we've now worked so hard to reach them. So how do we bring them into the fold? How do we make sure that they feel and experience the same positive effects of being in the room when they're sitting in their room at home? So how do we do that? And what platforms have been successful? I have seen virtual events go from kind of 0 to 1,000 over the past year, with so many impressive platforms out there where you can walk in, you can go to the poster session, there's networking rooms. You know, what are these platforms like? Are we going to keep those when we go to the hybrid model? Or is it going to be much like we're doing now, where it's just kind of live streaming and seeing the video of what's happening? All important things to consider. And I think questions that we don't yet have the answers to. And the beauty of coming together with colleagues such as are here now, are learning from each other and talking through what the best approach is going forward. And also critically remembering there's such geographical differences in the vaccine rollout, in the R numbers right now. So not everywhere is going to be at the same pace. And so not everyone is going to be able to do the same things. And that's important to consider too. Next slide, please. I don't know about you, but when this all started, we had a lot of crisis meetings with our board. We relooked at our budget that was a pretty healthy budget after a really good and strong 2019. And we had predicted about a 40% increase in 2020. By April, it became very apparent that we had to sit down and reassess and look. And we actually put together a 3-phased approach that unfortunately involved some redundancies and some cuts to salaries. And we put in 3 phases. And I'm pleased to say we only had to dip into phase 1. We did lose, I think, 3 or 4 members of staff. We didn't end up having to cut any salaries, but we did stop some benefits across the year. But what I'm even happier to report is that 40% decrease that we predicted across the year, that at the end of 2020, it actually ended up being our biggest year to date. And I think it's because we pivoted, and we pivoted fast. We quickly realized that our community hadn't gone away. Our donors who had been able to donate before and were still able were still there. And yes, there were a lot of donors who had lost work and who were more vulnerable. And we had to work even harder to support those. And so we just kept doing. We kept putting things on. We put on events and reached thousands more than we've ever reached before in 45 plus countries. We kind of increased the speed in our plan to translate everything. And so we translated every conference into 5 languages. That was kind of more of a 3-year plan, but it very quickly turned into an immediate plan. And we took that risk of spending more money, but hoping that it would encourage more registrations, and it did. But I think there were so many lessons learned. I think we realized what the community needed. And of course, we were doing this in parallel with some very, very important topics being brought up in, like Black Lives Matters, the protests. And in 2019, we launched our Breaking Down Barriers campaign that was more relevant than ever during this year. And so during a pandemic, along with all these other struggles, it was very important to listen to what the community needed. And I think hearing and listening is what got us through not just surviving, but thriving. And I think it's really interesting to learn from each other on how we can do that and how we can survive through these times when we're organizations that rely on donations and rely on the generosity of our communities that are struggling too. So lots to learn and lots to think about as we go forward that we don't want to forget from this really challenging but really interesting year that's kind of been full of opportunity to develop too. Next slide, please. I think the other important thing that we, I think, made even more effort on, and perhaps historically hadn't put enough thought into, is providing support for our staff team and volunteers, not just through a pandemic, but beyond. And that's in the shape of an employee assistance program, EAPS. And they're by no means new, but they are just as important, if not more so, than they ever were. And for those that aren't aware, an EAP is a confidential professional service that provides advice, practical information, support and counselling to employees or volunteers on a wide range of personal and work-related issues. And some examples are stress, anxiety and/or low mood, marital or relationship problems, family problems, loss and grief, substance abuse issues, career guidance, parenting concerns, financial worries, questions around legal matters, and many, many more. And the society provided in kind of mid-2020 decided to provide EAP access across all of our team, wherever they're based. So Paychex is our US provider, and Spectrum Life fulfills the needs of team members across the rest of the world, which is currently the UK and Europe. And they are accessible 24 hours a day, 7 days a week, 365 days a year. And I think if good comes out of this, which actually it seems impossible to say, but a lot of good has come out of this and will continue to come out of this, it's acknowledging that the team around you requires this kind of support to get through the challenges like we've had this year, but also day-to-day life. It's also taught us how easy it is to work remotely and how many of us looking after organizations for rare diseases where often disability is a real factor, how easy it was for that to be there the whole time, and not just in the non-profit space, but let's hope that those lessons continue throughout the workspace so that more and more people are offered that as a choice rather than it being a reactive response to a request from someone that needs those kind of accessibility thoughts in place. So the other thing that I think is going to be a huge benefit, and I've spoken about this before, is what's the impact on the rare disease space, chronic disease space on long COVID. So many of our community suffered from these symptoms and for many, many years with no funding, no credibility, no focus. And suddenly the word COVID's involved in these symptoms. You've never seen more interest. And I think that we're going to benefit from that long term. It's unfortunate it took this to get there, but I think more and more people are realizing how impactful these kind of symptoms are and how much they can have an impact on quality of life. And I think that is all from me. Just check the next slide. Yes, it is Q&A time. So Parvati, back to you.
Thank you, Ms. Barnett, Dr. Friedman, and Laura for just a wonderful talk. I see some messages there in the chat box. I know all of you took time to also submit some questions to the panel when you were registering for the event. So we'll start with some of the questions that you had sent across to us when you registered, and then we'll open it up for all of you to ask our speakers and each other questions around this topic. So the first question I have is for Ms. Barnett. organizations do to provide more emotional support for caregivers?
Well, our approach, our educational approach is based on, as I said before, peer-to-peer learning, and that caregivers need practical guidance, problem-solving skills, and utilitarian advice. Um, so they don't need lectures or theory, but much of their frustration and emotional distress actually comes from not having access to knowledge on how to manage and improve their situations. So I think making sure that that piece is in place would go a long way, um, just in providing emotional support. Because when we don't know things, when we don't understand things, that's a stressor.
Thank you. Laura, how can organizations approach the new normal in terms of programming and re-entry into in-person events appropriately? And you mentioned this a little in your talk.
Yeah. So I touched on this on the talk, but I think it's going to be a real kind of learn as we go process in the way that we've all shown that we can do so well over the past year. And we're not going to know what people are going to feel like. There's going to be a lot of anxiety and nerves about coming together in a room. And equally, a lot of excitement. You know, some people cannot wait to get back out there, and some people are filled with fear and dread. Both are very valid thoughts and feelings, and we have to cater for all. So everything that we are doing, I think in the short term and the long term, is going to always have a hybrid element to it. And that's not just for our patient-focused conferences, which I think go without saying, but also thinking about our medical community. We always kind of had research meetings, for example, where we would bring everyone together, and you know, there wasn't really an opportunity to take part unless you were there in the room. And understanding that some medical professionals, their institutions may not allow travel yet, ensuring that that option is there, but also that some of them have such busy schedules that actually they may really appreciate long-term a hybrid offering. So I think being fluid, allowing things to marinate, and let's just see what happens and learn as we go, and be willing to change and adapt and keep pivoting as we have been. And I think that's the key for the next probably 2 to 5 years.
Dr. Friedman, thank you, Laura. Have you any learnings from the COVID strengthened organizations in any way? How have these learnings strengthened them and some of the struggles that you've come across?
Well, as I mentioned during my presentation, I believe that our organizations and members have recognized that we're stronger than we think we are, individually and collectively. And an acknowledgement that we are adaptive, resilient, and strong communities because we've had to be by virtue of the nature of the rare diseases that we face. And I believe at an emotional level that many of us in our organizations have had a head start on the rest of the world because we've always had to be adaptive. In terms of the practical programming, as Professor Laura just said, this hybrid model has evolved very quickly as a reaction to the pandemic. And I believe that some of our organizations and members have been strengthened by increased connections worldwide using technology that now is commonplace and didn't used to be used as commonly. Many more of our rare disease community members are now using this technology to get access to programs, to get access to connections with each other. And personally speaking, through telehealth, it's a lot easier for me to have my son consulting with us about his medical needs remotely than to get him and his nurse and his ventilator and his equipment into a van and driving it 45 minutes into the city. So indirectly, I feel like we are individually and collectively strengthened by better access through the technology. Those are a couple of things I can think of that are what I would call silver linings or unanticipated positive consequences of such a difficult time during the pandemic, just as my son has taught me that there's some positive unanticipated consequences of his situation. I never would have thought anything positive could come out of his diagnosis, but he has a lot of gifts, and I've met some wonderful people. Another silver lining. So I think individually and collectively, we have found silver linings in this situation.
Okay. Thank you so much, and that's very true. Ms. Barnett, what are some of the most important takeaways for you that you've seen in the caregiver support world from the pandemic?
I think succinctly, the need for adaptability and contingency planning, as well as the importance of technology skills.
Thank you. A follow-up question to Dr. Friedman. Online mental health resources for patients and communities that you would recommend?
Sure. It's in our country, our healthcare system and our mental health system specifically do leave a lot to be desired in terms of access to services. There are a number of hotlines, and there are a number of online resources through national organizations like the National Association of Mental Illness, NAMI, and AMI. The Anxiety and Depression Association of America has many good online resources. The American Psychological Association has excellent resources and COVID-specific resources. I noticed my friend Katie from the Child Neurology Foundation is on attending this presentation. Child Neurology Foundation has excellent online resources for mental health. I've been privileged to be part of their work as well. There are apps that my clients use, I use myself, like Headspace and Calm are meditation apps that are free and offer very specific and guided meditation exercises for folks. So those are a few examples of online resources, and I'd like to add that again, telehealth. Some of our rare disease community members have been surprised that availability of mental health resources that didn't used to be available before the pandemic through telehealth, and insurance is now covering services that weren't covered before the pandemic in many cases. Employers employ EAP programs are providing services. So it's worth investigating through your healthcare system that you already access what might be available that isn't available. We all have busy lives, and it's hard for us who are taking care of our family members, as I am, to keep up with all the changes as they evolve. And these changes have come quickly, and some are positive in terms of access to services. I hope that's helpful.
Thank you so much. And I'm opening this up to all three of you. So I know you all have amazing thoughts on these, but I saw this question come up. If you can touch a little bit more on sibling support, care partners support, or just, if you have a rare disease and you have a child, how do you take care of that? Like, what kind of support systems would you suggest for any one of those scenarios? So I leave it up to all of you, whoever wants to take that.
I'd be happy to comment. I think the first step, Parvati, is for all of us in our rare disease communities to acknowledge that each of these perspectives, each of these situations, to be a sibling, to be my son's sister, my daughter Kara, has its own unique challenges. To be a caregiver has its own unique challenges. To be a grandparent has its own unique challenges. So I think the first step is identifying each person within a family and surrounding the person affected by rare disease as someone in need as well. And then to think creatively about how to support their needs. And that can be done by as simply as having a session with guidance for families, using the example of siblings. I've led a number of sessions for families about how to support the emotional needs of siblings in their family who are often in the shadow of the child's situation that's being treated. In our Cure SMA community, we have separate sessions for siblings that are run by a sibling of another child with SMA, an adult sibling, and it gives the kids an opportunity who have siblings to talk to each other. And again, as the pandemic has evolved, we're all adapting our programs accordingly to virtual means in order to make these connections. So there are a number of ways to do it, but the first step is recognizing and acknowledging that all of our family members have needs and they're different from each other, and that we all feel isolated in those roles, and to have the opportunity to connect with each other in any way that we can, and to have direction from professionals who have knowledge about the psychological experience of people in these various situations within the family can be very useful as well.
And I'd just like to add that I think from an organizational point of view, from what we can think about providing that support, is virtual support groups. You know, so often people, either caregivers or those living with the condition, have never met anyone else impacted with the condition or in the same spot. And the virtual model works even better than in person because anyone can take part. And we, I think by March the, sorry, that was my alarm, by March the 20th, we we had a monthly virtual support group program in place. And by mid-March, we increased that to 3 a week, and in time zones so that people in Asia, Australia, Europe, America would have someone to talk to. And we've got them focused on the patient, caregiver, parents, one for men, LGBTQ+. We've got all different kinds of groupings to encourage that support that I think is needed more than ever. And just while I'm here, because I can see James put a question in the chat about the translations. So we are using live voice translators. We had the privilege of meeting an incredible team. We did a conference in Madrid and they were all there in person in like the booth. It was like the Eurovision, you know, where they're all there and they've got their headphones and they're speaking that language. And it was a thing to marvel at. And we were planning last April a conference, European conference in Paris. And of course it was cancelled. And so we said to them, how about doing this virtually? And it was the first one they'd done. And now I think it's all they're doing. So they translate live into 5 languages. They're doing it across 6 of our events this year. We've also got captioning on top of that for further accessibility. And we're currently looking at putting our summer conference, American Sign Language as well. So I think just really thinking about all the barriers that can be there for people virtually, thinking about technology restrictions, try and overcome those and think that although technology answers many questions, it also does give some barriers to people.
Thank you. And we have one more question for you, Laura, while we still have you in the spotlight. What are some of the latest trends you have used or observed in virtual programming?
So I think the thing that's come out, or one of the biggest wants and needs, is an opportunity to network and to do something other than just watch a presentation. So something that we introduced last summer that was very popular, and we're going to do it again this summer, was we had obviously you can see our logo is a zebra, and a group of zebras together is called a dazzle, for those that don't know that wonderful tidbit of information. And so we introduced our dazzle talent show, and so everyone was able to submit photography, them doing dance, singing, performing, reading poetry, pretty much anything you can think of. And there was a way on the platform we used the Hoover platform for people to look at those, view them, and we had a winner, and it was great because it was a way for people to talk. The other reason we love the Hoover model is that you are able to create breakout conversations. And we had hundreds and hundreds of breakout conversations, like living in Orlando with EDS with dogs, come and talk here, like the most random things. And there were people there meeting, you know, living in Belgium with vascular EDS, and people come together. And I think that that's really important, allowing that social connection and that discussion outside of the didactic is important. Something I've noticed a shift, and we're actually thinking about implementing this in our later scheduling for the year because everything else is planned now, is people are moving away from the kind of slides and the presentations to a much more panel focus and conversation, because it's much more engaging. You can interact much more. You also get sometimes a better quality of conversation because people that they have the fluidity to be able to move around and think about things they may not have said when they're just doing their usual presentation. And it's often a richer conversation. So we're looking at that as well, but kind of mix it up and realize that there's a lot of opportunity and potential as well as limits.
Thank you so much. Ms. Barnett, this question came through for you. How are you meeting the needs of your community during the pandemic, given like the medical unrest, the social unrest? There's just so much going on. So how have you been able to reach out and support your community of caregivers?
We are doing a lot of things one-on-one because that's how we promote ourselves, peer to peer. So one thing that we use, we call it care coaching. So we really do, literally, based upon what your particular situation may be, we work with you one-on-one to find some successful strategies that you can use in your own particular situation. But we're also doing a lot of things virtually. As we get requests for presentations, we're able to especially talk about our 10-point program. And we're finding that that's something that people find very useful in their situations. So that's what we're doing.
Thank you so much. Dr. Friedman, this is a very interesting question because I've noticed this in our school setting, but what are some of the challenges and setbacks for children that have, with rare disease and their siblings that have experienced during COVID? I know that physical, like a lot of therapies were halted or delayed, but from an emotional standpoint, how do you think that's impacted our rare disease children more so with the pandemic?
My experience is there's a wide range of responses among children. Many of our children affected by rare disease were already accustomed to having different educational setting because of physical limitations or medical fragility. So ironically, in my practice and in my work, I've actually seen more stress manifested among children who don't have rare diseases and whose routines have been interrupted because they're not accustomed to being isolated. They're not accustomed to living with uncertainty, and they're not accustomed to needing to protect themselves from illnesses. Now, that's not to say that our children affected by rare disease haven't been affected. It's just to say that our kids have more practice under unusual conditions. So their ability to adapt to changing conditions is different than kids who don't have that practice. That being said, because many in our rare disease communities are vulnerable medically, there has been more isolation for kids who can go to school and do go to school under normal conditions. And that's been hard for our rare disease community kids, just as it has been for other kids. So I don't think there are any surprises in terms of how the pandemic has impacted our kids differently than other kids. It's been hard for all kids. It's been hard for all parents. It's been hard for all of us. And we all need connection, and we all don't do as well without social interaction. Kids don't do as well without structure, without the structure of school. So for our rare disease kids and other kids, all of this has been a great challenge, and their stressors and mental health challenges have been significant this year. As a practitioner, I can tell you I've been busier this year than any year, and through the summer as well, because this has been such an unusual set of conditions. The other comment I'd make is that we adults have lived longer, so we have more perspective over a period of years on how the world works. And one of the risks, I think, for our children is that because they're younger and have lived shorter lives, they may, some of our kids think that this is going to happen over and over again, or this is the way life is going to work from here on out. This pandemic has been a once out of 100-year event, and hopefully will remain that way in terms of probability. But if you're a 5 or 6 or 7-year-old child, and this goes on 2 years, that's a big chunk of your life. Whereas for us folks who have more years on us, it's a smaller chunk of our life. So we adults can offer perspective and reassurance to our kids about that. But it is something I've seen in my practice as the world has become so complicated recently, that there's a sense that this is going to continue to be stressful, and that isn't hopefully going to be the case. I hope I could go a whole hour on this topic, and I hope these comments are helpful in a few minutes.
Thank you so very much. And this last question, before I open it up for anybody else here who would want to actually ask you the question themselves. Young to adult transition has always been a topic that's very difficult for both caregivers and for the patients themselves. So the question I believe that Alan had was, what about the transition into adult services? The process has serious issues for any health condition and the impact that it has on mental health, and both on the caregiver and the patient itself.
Is that a question for me?
Oh, yeah, all three of you can answer that before we close up.
Well, I appreciate the question. I appreciate the question very much as a dad first, because my own son is still in the process of transitioning into adult services. And it is a very complicated and stressful process for many in the rare disease community. And it's especially stressful for families like mine where there haven't been adult services, and because some of our kids haven't lived to adulthood. So there's a new population of kids. My son's on the front end of a new generation of kids that didn't used to be here, given the severity of his illness. So the pandemic has slowed things down and complicated things on one hand. And on the other hand, because of telehealth, there's been easier access to have these transition conversations for many of us, and for me personally. And the other comment I'd make is the pandemic's been a gift because it has offered more time for some of us to delay that transition that we don't want to have in the first place. So it gives the providers more time to get ready for us. For the providers, because I'm a member of our medical advisory group, the Cura Seme, I know a lot of doctors and interact with them all the time. And this set of conditions is very difficult for doctors too, for many reasons. So I think everything about the healthcare system has shifted during this pandemic, and the providers have had to adapt as well in ways that sometimes they wouldn't choose, but they're responding to the conditions that they're presented with and working with their systems and trying to do their jobs responsibly. And it's hard for them, and it's hard for us families as well. Just a couple thoughts for you, and thank you for the question.
Thank you all for taking time to join us for our first Rare Leader Meetup today. A special thanks to Laura, Ms. Barnett, and Dr. Friedman for your wonderful thoughts and all of the wisdom that you shared today. On behalf of Global Genes, just very thankful to have you all here. And we've recorded this meeting, so we will share it with our members who could not join us for this panel. So thank you once again very much for taking time this afternoon to join.
Thank you.
Yeah.
Thank you for having us.